Hello everyone, welcome to Jessie's MedBio. In today's section, I am going to explain about the organization of neonatal care unit and about the neonatal equipment. So, what all are the physical facilities which is coming under the neonatal care unit means first one is the space. Space means it is the area provided for each newborn babies in the neonatal unit to ensure safe and effective care. For that, each newborn baby should have at least 100 square feet of space. And also, there should be enough distance between the incubators and the warmers. And we can provide extra space for the equipments and for doing the procedures and for providing the emergency care if needed. And what all are the important means it can able to prevent the overcrowding and it will helps to reduce the hospital acquired infections like that is nosocomial infections, and it helps the healthcare members for the easy movement of the equipment, and it will improve the quality of nursing care. The next one is the location. The neonatal unit should be located in a convenient place within the hospital for quick access, which means the neonatal unit should be located near the labor room, near the operation theatre and near the pediatric ICU. And it should be easily accessible by the ambulance and by the emergency services. And it is an area where natural sunlight should be received during the daytime. What all are the advantages means it can able for the quick transfer of sick newborns, and it should helps to save the valuable time during the emergencies, and it improves the patient safety. Then coming to the floor plan. Floor plan means it is an arrangement of different rooms and areas inside the neonatal unit. Then the ventilation. Ventilation means proper circulation of clean air should be there inside the neonatal unit. For that, fresh air circulation should be there, adequate exhaust system should be there, laminar airflow should be there. And what all are the importance means it can able to prevent the infection. It will helps to remove the contaminated air, maintain proper temperature and also improves the oxygen supply. Then about the lighting. Adequate lighting helps in examination and in providing proper nursing care. For proper lighting, a bright shadow-free illumination should be there, white fluorescent light should be there, spotlight for procedures, then emergency power backup should be there. It will helps to detect the jaundice, to detect cyanosis, and helps in doing certain type of medical procedures, and also helps to reduce the eye strain of the healthcare members. Then about the temperature and humidity. The temperature should be maintained in a degree Celsius of 28 plus or minus 2 degrees Celsius. Humidity should be maintained above 50% to prevent the hypothermia, prevent dehydration, and to prevent the heat loss, and to provide a thermo-neutral environment to the baby. The next one is the acoustic characteristics, which means about the noise control. Noise level inside the neonatal unit should be kept low. The noise should be low inside the neonatal unit. For that, the sound level should not exceed 75 dB. Then from where the noises are coming means from the monitors, ventilators, suction machines, staff conversations and door closing. So we have to make sure that all these things are controlling properly to reduce the sound. Then effects of excessive noise means sleep disturbances will be there, stress will be there, hearing damage will be there, heart rate will be increased, and also it will lead to reduced weight gain. Then how we can prevent means soundproof wall will be there, then soft closing doors, then reduce unnecessary talking, and also we have to maintain the equipments properly. Then next one is the electrical outlet. Neonatal unit should have an uninterrupted electrical supply for life-saving equipment. For that, adequate electrical outlets should be there for each baby. Uninterrupted power supply should be there, generator backup should be there, proper earthing and safety measures should be followed. Then it will ensure the continuous functioning of incubators, ventilators, monitors, infusion pumps and phototherapy unit, and also it will help to prevent the interruption of treatment during power failure. Then infection control and ward culture. Infection control refers to the practices that prevent the hospital acquired infections. For that, we have to maintain a strict hand hygiene. We have to use sterile gloves, masks, gowns, and regular cleaning and disinfection should be there. Separate infected and non-infected babies. Then we have to follow the proper biomedical waste management. Then restrict the visitors entry, and equipment should be sterilized properly. It can able to prevent the cross infection, and also it will help to reduce the neonatal morbidity and mortality, and it will provide a safe environment. Then handling and social contact, which means newborn should be handled gently to provide comfort while minimizing the stress. So while we are handling a baby, at that time we should handle them gently to provide comfort. Thus we can able to reduce the stress level among the newborn baby. For that, what all are the guidelines we should follow means we have to handle the baby gently and only when it is necessary. And while touching the baby, use soothing touch and gentle positioning. And we have to encourage the kangaroo mother care and the bonding between the parents and the babies. And we have to avoid excessive handling and loud noises. And it will help to reduce the stress, maintain stable heart rate and breathing, and it will promote the growth and emotional development. The next one is the communication system. Communication system allows quick exchange of information among healthcare providers and parents. We can able to exchange the information from healthcare providers and also to the parents. For what all are the facilities? So there means that is telephone, nurse call system, computer with internet. Then it will help for the quick immunization during emergency time, better coordination among the staff, and also it will keep the parents informed. That is about the physical facilities. Next one is the ward personnel. Ward personnel means these are the healthcare professionals who are responsible for providing the care to the neonates. So for that, first one is the medical staffs, that is the neonatologist, pediatrician and the resident doctors. Then coming to the nursing staff. Nursing superintendent, ward in charge, staff nurses, A&M and student nurses will be there. Then supporting staff, laboratory technician will be there, pharmacist, housekeeping staff, biomedical engineer or technicians will be there. It will help to provide 24-hour care. It will ensure the continuous monitoring and also it will promote quality nursing care. Next one is the equipment. Under the equipment, first one is the resuscitation equipment. Resuscitation equipment means what all are the equipments we are using for the resuscitation, which includes the laryngoscope, endotracheal tube, suction apparatus, bag and mask and the oxygen source. Then second one is the bag and mask resuscitation, which means it is a self-inflating bag which is used to provide the PPV to the newborn babies. So the capacity should be 250 to 750 ml and 3 sizes of face mask are available, 0, 1 and 2, and cushioned rim for an airtight seal will be there, and it will be using for neonatal resuscitation and also for the babies who is having respiratory distress. Then third one is oxygen and suction facilities, which contains oxygen cylinder, flow meter, humidifier, regulator, tubing and the suction machine. This will help to supply the oxygen and will help to clear the airway secretions and use during the time of emergencies. And next one is catheters, syringe and needles. It will include NG tube, suction catheter, umbilical vein catheter, IV infusion set, disposable syringes and needles. The importance are it will help in feeding, it will helps to provide IV therapy and for medication administration and for infection prevention. Then about the feeding equipment, which includes the glass or steel bowls, feeding cup, sterilizers, refrigerator for breast milk storage. It will help for the safe preparation of feeds and helps to prevent the contamination. Then coming to the weighing machine, it will contain the beam weighing machine and electronic weighing machine. It will helps to monitor the weight of the baby daily and also helps to monitor the growth and nutritional level. Then coming to the thermometer, the types are oral, rectal and digital. It will helps to detect the fever and also the hypothermia. And if we are using the individual thermometers, it will helps to reduce the cross infection. Then coming to the oxygen hood, which means it is a transparent plastic hood which will be placed over the baby's head, and it will provide the high level of concentration of oxygen. It is used for respiratory distress and also for the oxygen therapy in newborns. Then coming to the phototherapy unit, it is a device which uses the blue light to treat the neonatal jaundice. That is the hyperbilirubinemia. Hyperbilirubinemia means it is the increased level of unconjugated bilirubin. So, how the phototherapy is working means it will convert the unconjugated bilirubin to conjugated bilirubin by using the blue light. So, the wavelength should be 400 to 500 nanometer. The irradiance should be 4 to 6. Then the blue light is more effective, and it will helps to break down the bilirubin level and also helps to prevent the Kernicterus. Then coming to the infusion pump, it is a type of electronic device which will provide or deliver the very small amount of IV fluids and the medications. It is using for the low birth weight babies, for the total parenteral nutrition, and also for the continuous drug infusion. What all are the advantages means it will provide an accurate fluid delivery, then it will reduces the medication error, prevents the fluid overload, then prevents the fluid overload. That is about the equipments. Then coming to the laboratory facilities means the neonatal unit should have laboratory support for prompt diagnosis. For the proper diagnosis, the neonatal unit should contain a proper laboratory facility. It should contain the facilities for blood test, urine analysis, gastric aspirate examination, bilirubin estimation, for the radiology X-ray. It will helps for the early diagnosis, appropriate treatment, and helpful for the continuous monitoring. Then coming to the procedure manual, which means it is a procedure manual, is a written guide containing standard protocols for neonatal care. It is a written guide and it is containing certain protocols about the neonatal care. So it should contain the care of babies, how we have to care the baby, then about the admission and discharge criteria, infection prevention practices, how we can maintain the temperature, then recording of vital signs, and how we can handle the equipments, then the contact between the mother and baby policy, then management of emergencies. It will ensure the uniform nursing care, and also it will help to guide the new nurses. And so these all are about the organization of neonatal care unit and about the neonatal equipments.